What you can see is some of the work that's been going on, like housing units on the near west side and Michigan Street area. You can see the projects supported, certainly on the Michigan and Bridge Street corridors, as well as north and south. But you can also see there's not a lot of activity occurring on the outskirts and in some of the areas of need. Next, Alyssa has mapped the investment in neighborhoods of focus over the last 5 years. So this shows each year's investment specifically for the neighborhoods of focus. And so the circle represents the share of private investment that is occurring in the neighborhoods of focus. So the darker component, this 30%, is what's occurring in the neighborhoods of focus versus the rest of the city. Also the percentage of projects being completed, jobs being created, and housing units being built. While it looks good here, generally, if you look at more data over past years, I think the amount of investment and new jobs and housing units built needs to increase to make up for the disinvestment that has occurred. And then on this slide, Alyssa has mapped and represented the data by ward. So the last 5 years worth of investment and job creation and housing units added by ward, and you can see in the 3rd ward there's a significant disparity there for sure.
Which is consistent with our work session we had back in November last year.
Yes. So this is consistent with what we know needs to change, which is great. The opportunity here is that our strategic plan could be evaluated in a way that helps try to reduce these disparities and make more equitable investments across the city and in areas of need, more certainly. So geographic prioritization was one of the Rose Center Fellowship recommendations as it relates to economic development incentives, and how do we start to reinvest with our own public programs and funds in areas of need.
Kara, can I ask a question?
Mm-hmm.
Does this capture the projects only where there were incentives, or all projects in the universe?
Just in terms of public investment. So we have talked about that very question. How do we take development center data in terms of projects that did occur without our incentives to show other investment that may have occurred outside of our incentives? We've talked about doing that, but this only takes into consideration where public investment was made.
Thank you.
Because that's where we have
I'm looking at these numbers, and I know there's been more than that.
Yeah,
but they just
overall.
haven't overall, but they
Right.
just haven't received incentives.
That's exactly right.
It would be nice. I don't know how we capture that data. It would be nice to look at
Yes.
where that investment is without the incentives.
Yep, we can certainly take a look at that. Any questions on that? That's the last piece of the dashboard that currently exists. The 10th page is really just citations.
All right.
Go ahead.
Oh, no, I'm just going to see if there are questions. I know we've talked about this already in Economic Development Project Team, but those of you where this is new and you haven't seen this before, do you have questions for Kara?
Well, Kara, I read this report about a month ago. Matter of fact, I ended up having an opportunity to meet the young lady who wrote it. And then I seen it again at the Southside SID meeting. And my deepest concerns were the disparities within the 3rd ward. They were a lot more deeper than I thought. So she did some extensive work. So I think it's going to be a lot of development that we got to push into the 3rd ward. But I'm interested in finding out from you and then perhaps from her, what were some of her suggestions?
So that's the next piece of the presentation that we'll get to. I just want to show you this last map too, that she included in her presentation, the map of redlining districts. And if you see, we've also overlaid the neighborhoods of focus, which are the pink lines, and then the blue are the opportunity zones that have been designated. Some of these are actually not within the city, but just for just reference points, you can see that the neighborhoods of focus are a larger number of census tracts, and then the opportunity zones, because of the limitations, are only 8 in the city of Grand Rapids, but they certainly overlay with the areas of need. So they mirror the neighborhoods of focus with the exception of some on the upper northwest side. But when trying to synthesize where our focus should be, this helps point us in a direction. So her recommendations were threefold. One, she suggested that we use data in development decisions, empower the community in the development process, and to create a more robust city support for employment-related equity goals. The first, using this equity dashboard and decision-making process for development projects is helpful in providing strategic direction for future investment. We can make decisions about how we use our resources strategically now that we know where the opportunity lies and be intentional about that. She suggested that we consider a development scorecard where we place geographic priorities in areas of the city of need that ensure impact on disparities are being made, that we maintain wage level or quality jobs when making incentives, and then also focusing on transit-oriented development and continuing to build on service of existing infrastructure like transit. Sustainability and the creation of affordable housing were other components that she suggested adding. She also pointed out that the Twin Cities Equitable Development Scorecard was one good example of how this is being used in other cities. The second recommendation about empowering the community in the development process really allows for additional conversation with the community. Now that we have this data, we can share it with the community and empower the community with the knowledge and relationships to shape that development process. So she suggested that neighborhood resource teams be identified, 2 to 3 city staff across development-related departments, be assigned to each neighborhood to serve as a resource to enhance those communications and relationships as developments come forward or are being envisioned. And the third, to create a more robust city support for employment-related equity goals. She suggested that the city designate staff to convene workforce development partners to make an impact on local employment, including building skills, pipelines, and local match programs, which we don't currently do. We work with our partners in workforce development, but her recommendation is that the city has to take ownership and be more impactful in that work. She suggested that the New Orleans Network for Economic Opportunity is a good example to consider, where they invest in pipelines and skills building to make more investment in local employees and local vendors. And I think we've had conversations about this as it relates to city contracts as well. Her report is much more extensive. There is a full report online, but I would be glad to answer any questions that you might have or take any suggestions you would have to improve this dashboard. We will continue to monitor and maintain it and use it as a baseline in our strategic planning.
Great, thanks. Commissioner?
Yep, thank you, Kara. I did have the opportunity to hear Alyssa's presentation live a couple of months ago and was very impressed with her findings. I've said it before and I'll say it again. I think that we have to lean in very intentionally with regards to this particular issue if we desire to be the city that we tout ourselves to be. And so that requires not just intentionality, but we have to also be very aspirational in our efforts to be a complete medium-sized city. I think that to Commissioner Moody's point, it was very, and it is very discouraging, yet there's no big surprise when you look at the disparity that exists around development dollars in our 3 wards. But I think that we can either look at that as an opportunity or look at it or just really focus on the numbers. I want to suggest that we look at it through a lens of opportunity. And then lastly, I think that this is probably a better time than ever to reach out to the private sector and look to have some very substantive conversations around partnership. And I think that we will find right now, a number of organizations and influencers in our town who are willing to, who want to have not just dialogue, but are willing to put resources forward to address this issue because it's an embarrassment, and I think that there are those in our community who have resources who, again, don't want to live with this cloud over our city. And so I was meeting recently with Kara and with Eric, and I just think we should make this a significant priority, because if we can show ourselves as being a city that's committed to equitable opportunity, then I think the sky's the limit. And we can only do that if we have intentionality behind it, and we treat it as, with an all-hands-on-deck approach. And so we need not talk about this much longer. We need to get at it and begin to lean in. So.
Thanks,
Yep.
Commissioner. Any other final questions or comments for Kara? And then we'll wrap this up and move to our next special briefing. Commissioner, and then City Manager.
Okay, well, I just want to thank you, Kara, for this work, and I know you've got a lot ahead of you now, analyzing this and then moving forward. But I agree that if one part of the city body is suffering, the entire body is suffering. So I really appreciate the comments that my colleague just made, Commissioner Jones, and also Commissioner Lanier, for pointing out what we already know, but data has made it very, very clear, and now we have a roadmap, I think, to follow. So I'm excited about this, and do as well look at this as an opportunity.
Thanks. City Manager?
Thank you, Mayor. I want to, again, thank staff for their hard work on this. I also had the opportunity to talk to Licia. She's has some Austin ties and called me to let me know that. But she did great work on this project. I just wanted to also thank the commissioners for their comments about the need to recognize the Data Act with some urgency, in dovetailing this presentation with the previous presentation on Housing Now. I know the focus was on public investments for housing, but what occurred to me as I was looking at the data, not only the disparity of housing, but all the economic wage disparity and income disparity. And going back to the conversation we had on ADUs, we talked about that in a zoning context, but that really is also an income opportunity for homeowners. And so I think as we look at the Housing Now recommendations, it's not just about housing, but it's economic opportunity that homeowners can have by creating another source of income, as well as improving quality of life for family and other renters who may not be able to afford the increased cost of living. So I just wanted to share that as well.
Thank you. All right. Thank you, Kara. Appreciate
you're
this.
welcome.
I know it's made available publicly on our website. Commissioners, feel free to share that with others who may find it useful. And then also we'll look forward to getting an update on next steps as well for the Equitable Economic Development Strategy. I know you're in conversations about that as well.
Yes,
So-
our steering committee meeting is scheduled for next Friday, so we'll keep you posted on that Economic Development Project team.
Great, thank you. All right, Commissioners, next that will take us to our briefing and update from the Kent County Essential Needs Task Force. So I'll invite Connie to come up. Connie serves on the steering committee for that, and I'll have her introduce the guests and tee up this presentation. I believe we were sent a copy of this morning, but were we going to get a hard copy as well, or just the electronic copy?
We just had it
Okay.
here. If you'd like a copy, we can make copies.
Okay, so Commissioners, you all should have received a copy of this PowerPoint in your email box this morning. Okay?
So, good afternoon, and I'm happy that Wendy Randall is here today as the Executive Director of the Kent County Essential Needs Task Force. Just to give you a little background, because a few of you may not be well versed in this topic, but the task force has been around. It was formed in 1982, so it's been in existence a very long time. It started out as the Emergency Needs Task Force, and so there has been evolution over the years in terms of its goals and priorities and how work is accomplished, but it has always had the focus of being a community collaborative comprised of nonprofit organizations, government agencies, and our philanthropic community to work in partnership in a more systematic approach to addressing basic needs of our citizens throughout Kent County. And it was established in 1982 as a result of issues arising from an economic recession in the early 1980s that really had folks needing resources related to housing crisis, lack of transportation dollars, a lot of community needs in terms of utility shutoffs and those types of issues. So again, it was put together as a collaborative of those agencies who are on the ground working to do that, as well as funders who tried to support those issues. So we have Wendy here who will talk about where we're at today and what's going to happen in the future.
Thank you. Hi, Wendy, welcome.
Thank you. I want to express my thanks to all of you for allowing me to be here today. Just a little bit of background for myself. I've been in this role for about 1.5 years now, so I realize it's been a little while since you've heard an update from us, and I apologize for that. But I thank you for this opportunity now. I think anytime there's a transition in collaboration, of course, that means building relationships and making sure that that the momentum continues to move forward. And I think we've done a great job with that over the last 1.5 years or so. And I appreciate the work done by my predecessor in kind of setting that stage and getting all the strategies in place for those committees to work on. So I'm going to start with just a little bit of a brief overview, similar to what Connie provided you. Essential Needs Task Force has been around for many years. It wasn't until about 8 years ago that there was really a full-time staff dedicated to this group. So a lot of the participation of the member nonprofit service providers and representation from local governments and from the philanthropy, a lot of that time has been seen as kind of an add-on to people's responsibilities in their home jobs. And really what we want to focus on is how do we change that mentality and how do we help people recognize that the work that they do is more effective when they're working together in collaboration. So rather than having this be kind of an extra thing that layers on top of the capacity that's so limited as we know, we like to view this as an opportunity to really be much more effective and efficient in the work that we're doing. So you'll see we've got the 5 areas of focus: transportation, food and nutrition, energy efficiency, economic and workforce development, and then housing under the coalition to end homelessness. The primary vision, of course, is for all residents of Kent County to have access to resources to meet their basic needs, primarily in these areas. One of the things that's most important here is the interconnectivity of sectors. So we recognize that when someone enters into one of these systems, identifying with a particular area of need, that is not the only area that they're addressing in their life at that time. So they may come into the system with, as an example, with an employment need, but there may be housing issues, there may be education issues, there may be health issues, there may be transportation issues that are all layered on top of that, but the one presenting need is kind of where they enter into the ENTF system. So what we do is not only work within each of those systems to collaborate on the strategies to improve resource availability, but we also look at how those systems interconnect and how we can ensure that the providers in one area are also able to build that relationship with other sectors and build that bridge for those individuals to access the resources they need. So on this next slide, I don't expect you to be able to read any of the words that are in those little squares and dots along the right-hand side, but this is just a quick representation of how the systems work together. So you'll see there's kind of some collective grouping that occurs across systems, and this is one of the visualizations that was provided in partnership with K-Connect. They did some great work across the community to really look at the different sectors and identify the providers and the entities that are participating in the conversations around those areas. So this, if you were to take their entire network map and narrow it down to those organizations that are affiliated with ENTF, this is the map that you would see. So this is divided by our different areas of focus, and as you can see simply by the volume of images on that network map, there are several dozen representative organizations that are participating in these conversations on building strategies and moving the progress forward. Key components to how we work together is listening and understanding, making sure that we're hearing the voices not only of the service providers and what they're witnessing, but the experience of those that are coming in and seeking services. Coordinating, as Connie mentioned earlier, the coordination and alignment of services is extremely important, so we're not creating unnecessary duplication across the community, but also so we're not allowing individuals to fall between the cracks. And then co-designing and collaborating, so ensuring that we're taking that voice of the individuals experiencing that need and incorporating that into the design of these strategies and programs. So rather than just coming up with an idea and saying, well, we think this will work in our community, really working with the residents to understand their experience and have their support and building up their strength and their decision-making in how we implement new programming. This is something that is a challenge, I think, for many organizations and many collaborative entities, because we have to play that balance then of how do you lift up that voice and support those individuals when you know that this is an add-on to their daily life, right? So they don't necessarily get the compensation or have the opportunity to be involved in these conversations. So we're really digging in now to how do we do that in a way that values their participation and gives them an opportunity to be part of something where they're already meeting, where they're already part of gathering in the community. I'm going to go quickly through each of the 5 subcommittee areas to give you a brief update on each. In the transportation subcommittee, of course, the vision is for residents to have access to multiple transportation choices. So recent things that we've done, we provided a municipal survey across the county to identify which municipalities were aware of and participating in various transportation opportunities for their residents. What that revealed was there was a lot of miscommunication and a lot of conflict in what people thought was available and what they thought their residents needed. So we're digging into that now to make recommendations for municipalities on a transportation in all policies checklist. If you're familiar with health in all policies, this is a similar concept. So it's when the municipalities are going through their planning processes and looking at development opportunities, they're thinking through what are the considerations around transportation that need to be part of this process. Not specific recommendations on what needs to happen, but are the considerations being made? Is there a meaningful discussion around multiple modes of transportation for various income groups and for various geographies where that development may occur? Another thing that we're working on currently is a revision of the process for distributing community development block grant funds for transportation from the county. So right now, through the both through the senior millage and through CDBG funds, there is transportation access available for the elderly, for senior citizens, and for people with disabilities to get to employment and medical appointments and things like that, but it is limited and it's not distributed equitably throughout the county. So we're looking at restructuring that, that payment distribution so that all residents have equal access. Now this is for transportation that originates outside of the 6 cities. So it's for those municipalities that are not part of the rapid process right now. And then we're looking at how can we leverage collaborative transportation solutions. So one of the things that we found was that there are several ride opportunities that are denied based on either capacity or on funding. So on this slide, if you'll look at the 2 charts, you can see the rides that are provided through RideLink, which is the senior millage dollars for transportation. Those rides are, we have a high volume of rides in those areas. We have anywhere from 2,000 to over 6,000 rides per month, but we also have a fairly high volume of denials. And those denials frequently occur because someone has reached the cap for their ride allotment for that month, or because it's a time of day when there isn't the capacity for rides to be available to them because of the demand at that time of day. So we're looking at opportunities to leverage dollars to really have a more comprehensive transportation option available for people. Because one of the things that we're finding is that this allows them not only their work opportunities, but it also allows for senior citizens especially an opportunity to engage in the community that they may not otherwise have. So as we're looking at becoming age-friendly, we want to also ensure that we have that opportunity for people to be out in the community, engaged in activities across all areas of the county. Looking now at energy efficiency and utilities, our goal, of course, is to have all residents have access to adequate utility service, so reducing or eliminating shutoffs across the board for utilities. One of the things that we've done in partnership with Kent County Community Action and with Calvin College's Center for Social Research and with Consumers Energy is we've done some mapping of the areas that are most at risk of receiving shutoff notices or being shut off. You'll see that from 2016 to 2017, we did see a positive shift. So the coverage of consumers who had consistent utility service, so no shutoffs during that time frame, shifted from 86.6% to 89.5%. So we're hopeful that, though we don't have the research that really sees this play out from the types of interactions, we're hopeful that the increase in LIHEAP dollars or federal dollars available to support energy use and heating, and the increase in weatherization throughout the county has helped improve this rate. So we're currently looking at what additional recommendations or what additional interventions can we implement that reduce energy consumption so that people have more consistent availability to pay those bills and to know that they're also living in a safe housing environment. This next slide is a map of some of the kind of monthly trends of how payment assistance is distributed. One of the issues that we run into is that Michigan has what they call a heating season, so certain times of year when utility assistance is available based on when the funding comes from the federal government, but also based on cold weather months. And so the cycle is a little bit offset between when the dollars are available and when people are hitting that point of greatest need where they're past due on their previous payments. So one of the interventions, of course, is to get people involved on payment plans with the utilities so that they don't have that spike in payments across the year, but also to advocate for the availability of funds throughout the year so we're not seeing those large spikes again right when those funds become available. In the area of economic and workforce development, a lot of the topics that were discussed earlier in the dashboard are extremely relevant to this subcommittee. So we have been having some conversations with folks from various city departments as well as all the service providers throughout the community on what we can do to ensure that those who are seeking employment have the best opportunities for increasing not only their employment sustainability, but also increasing generational wealth. So we've done a couple different things through our action teams in this area. We're looking at utilizing best practices and ensuring that all of the service providers are consistent with those best practices. This allows us to reduce duplication across the community, but also to understand the nuances that are appropriate when people are coming in with different presenting needs. We're also looking at how we communicate those services that are available. We have found that there are lots of claims that the workforce development system is confusing, and how do you enter into the right door to make sure that you're getting the services that are appropriate, whether you're an employer or whether you're another service provider who's a partner, or whether you're an individual who's seeking employment or seeking advancement in their work. So we're really looking at increasing or improving our communication methods as well as developing partnerships across sectors so that organizations who are working in the food system and in the housing system and in the mental health system have direct relationships with those who are working in the workforce development system. So when they see someone presenting with one of those areas of need and recognize that income is one of the factors in that area of need, they also can then link that individual into the workforce development system to get the resource, to get the supports and services available. We're also looking at a data decision-making tree. So again, similar to what Kara was discussing earlier, the Economic and Workforce Development Committee has designed a tool that will allow us to utilize the data that we retain from both our best practices report card as well as from our outcomes report card and make recommendations back to the system on what changes may need to occur. So where is there opportunity for partnership? Where are there opportunities for us to leverage funds differently so that we're most effective in workforce development areas? And then we also have an equity toolkit that has recently been released that we've asked all of our partner organizations to begin to utilize within their organization. So again, this is just an opportunity to elicit conversation and to really get people thinking about how we implement programming and services in a way that's intentional and in a way that takes the best interest of those we're serving into mind. On this last slide for workforce development, you can see how there's some clustering of adherence to best practices. So when we asked organizations to tell us how they're delivering services and what types of services they're really implementing across those they're serving, this is a chart of how they responded to those questions. So we're looking to increase adherence, so move more of those circles over to the right-hand side as we continue to push forward with this initiative. In the food and nutrition area, we've recently broken into some action teams to focus on 4 areas: health, education, policy, and community power. What's interesting about this area is there was a significant decrease in membership over a couple of years that occurred when there was some pretty intensive conversation around a charity model and a systems approach to food justice in the community. And I'm sure that we all can recognize that there's a transaction that occurs when we engage in a service provision. And for some service areas, particularly in the area of food access, there was an emotional connection to those transactions for not only the people donating to pantries, but for those individuals receiving services from pantries. So we've been making a real distinct effort to change that thinking from how do we increase donations to how do we improve the structure of the system so people aren't as in need and don't need to come in for those donations, don't need to access the pantries as frequently. So we've been looking much more at root causes of pantry need, and a lot of that comes down to income. A lot of that also comes down to other social determinants of health. So when people don't have access to food and nutrition and wellness opportunities, what does that mean in terms of their long-term outcomes for their household, but also what does that mean for then generational wealth for their household? Because as medical needs increase, the opportunity for wealth decreases. So we've been looking at how do we engage more closely with our resident neighbors to understand their experiences and create plans to implement where they are the ones guiding the program design and delivery. And they're looking at not only supporting that crisis intervention aspect, so still coordinating what's happening with the pantries, but also incorporating more education, nutritional awareness, and wellness activities into those places where people are gathering so that we're reducing the need for them to access those pantries. Finally, in this area, we're working on the development of a Kent County Food Policy Council. So some of you may be familiar with a Grand Rapids Area Food Policy Council that existed several years ago. That group has since gone in different directions, and we've received some support to create this new Kent County Food Policy Council as a way to better understand policy needs, not only in the area of food access, but also looking at food processing and distribution, looking at nutrition in schools, and looking at growers associations, and also opportunities for entrepreneurship around food. And how do we work with the community to design policy recommendations in those areas, both for institutions and for institutional purchasing, as well as for municipalities and community organizations. So that group is in formation at this time. This is just a quick slide of some of our engagement and collaboration activities. We do actually get together and meet. Finally, our last area is the Coalition to End Homelessness. And I put this last because it's such an important topic, and I know that it's a high priority area for many of you. And it's also one that's difficult to work through because it takes a long time for development to occur, but it also means looking at opportunities from different perspectives and being able to approach things with multiple approaches in order to resolve the issue. So a couple of things to keep in mind in terms of promising practices for the coalition. We, of course, utilize Housing First, which is elimination of barriers is secondary to the person getting into housing. So there should not be prerequisites to accessing housing opportunities. This has been a little bit of a shift for some of our providers because it means kind of letting go of some of that eligibility that's tied to shelter or tied to other housing opportunities. So being able to say, come as you you are, and we will help and support you in achieving your housing goals. And then we'll connect you with those other resources to resolve barriers as you move forward. But it's not a prerequisite for you to resolve those barriers before getting into housing. So this really helps ensure that people are safe, and then provides the assistance for them to get support in those other systems areas. Coordinated entry is an approach that we've taken over the last several years in this community, and it really allows for us to prioritize those who are most vulnerable in the community to have access to the resources as soon as they're available. The challenge with coordinated entry, of course, is that there aren't enough resources in our community to bring those people into that appropriate housing situation. So the frustration with many the frustration that many people experience when they're working with coordinated entry is feeling like it's going nowhere, feeling like there are no options and that it's just kind of a bottleneck. But the reality is the issue that we have is in our resources and the availability of resources for housing rather than in the process itself. The process does look at vulnerability and categories of vulnerability to identify those most at need, such as families and those who are chronically homeless, and help work those people into the most appropriate housing situation as quickly as possible. On the right-hand side, you'll see two charts of some of our system performance measures. We have length of time homeless for emergency shelter and transitional housing, and then length of time homeless for emergency shelter families. So the number in those circles represents the days, median days or average days homeless in those categories. In terms of representation of counts, let me find the right page here. If we look at single individuals, so in that top chart, the number of people that these represent is around 2,700 to 3,000 individuals. So of those individuals at any given time, their length of stay or their length of time homeless could be around between 31 days and 68 days between median and average. Now, of course, some people enter into a shelter for one day and they may be moving through our community, so they may not return to that shelter. Some individuals are going to stay for significant amounts of time because there might not be a resource available for them in the near future. So there are significant differences there. We know that the resources for families are much more limited than they are for singles. And so in the bottom chart, you'll see that length of stay homeless is nearly double for the median length of time homeless for families as it is for singles. This represents a volume of about 700 individuals within families. So not 700 families, but counting all the members of those households, about 700 members are experiencing that homelessness at any given time. We do have, I'm sure you're familiar with the eviction prevention pilot that's going on right now. We do have that support and partnership in some innovative ideas of how to resolve homelessness or how to prevent homelessness in the community. We also have a diversion pilot that's going right now for families to be diverted from shelter into an alternative housing opportunity. And then around veteran homelessness, last year we did achieve the status of functional zero for veteran homelessness, which means that a veteran who identifies themselves as they enter into the system is quickly attached to services to get them into housing within 90 days. So it's a quick process rather than having some different loopholes or different hoops that they have to jump through. So it's important for us to be able to maintain that status. So we want to keep a focus on veteran housing, but we also want to expand our focus to other vulnerable populations. So being able to look at family homelessness and really address that issue is one that's top of mind for many individuals in the community right now. We're also looking at youth homelessness as an area of focus. One of the things that we're excited about is we just had our first Voices of Youth point in time count in the community. So what that means is our annual point in time count occurs in January, and we look at those numbers to determine, are we making a shift in the number of people that we get into shelters and get into housing during those critical months when it's coldest in the community. But we haven't been able to accurately capture that range of 10 to 24-year-olds that fall under independent youth homelessness. So this Voice of Youth count was informed by youth in the community. It was with their input that we discussed how to make this count happen, how to engage with youth, and get an accurate count. That occurred just last week, so we're excited to be able to look at the data and share that with you in the near future. We're hoping that that will help inform specific initiatives.
Yeah, Commissioner Lenny?
Quick question. So are you all partnering with Covenant House and other organizations who are providing shelter?
Yes, absolutely. Yep. Our membership for the COC ranges, it's generally between 60 and 75 organizations that we partner with. Many of those are direct service providers like Covenant House. They have representation that attends the coalition meetings. But that also means that when we break down into specific focus areas, that we have those kind of smaller group discussions with those who are providing that service firsthand. So we do have a youth committee that focuses on individuals who are in that younger adult age range or kind of older teen, younger adult age range. Many of those are independent youth, and so how do we help them stabilize their situation where they're not going to increase their risk or their vulnerability. A lot of those individuals fear being part of a system because they have a lack of trust of what systems can bring them. So we used their input to help form this event to have an accurate count. We're also using them. We have a newly formed Youth Action Board, which is members of the youth community. It's membership driven, so they will be coming up with their own recommendations that they will bring to the Coalition Steering Committee for implementation of new services and projects.
Right.
So Wendy, I just have a follow-up question related to the numbers then. So this, on this slide, the point in time counts, I'm just looking at 2018. So do these counts not include youth?
The youth, if you go down a little bit for persons in parenting youth and unaccompanied youth, you'll see some smaller numbers in counts there. We believe that to be very underrepresented.
Okay, that was going to be my follow-up question. And then on the prior slide, you referenced the average length of time, and you referenced roughly 2,700 to 3,000 individuals, unique individuals. So help me understand or maybe reconcile that number with the point in time counts.
Yeah, sure. So the point in time counts is individuals who are Category 1 homeless at that time on that specific day when the count occurs. What that means is they're not participating in a program at that moment. They're potentially in shelter or unsheltered, but they're not part of a transitional program, for example, a rapid rehousing program or a permanent supportive housing program. Once someone moves into one of those programs where there's a resource available, they still are tracked so we can understand their progress and see if they're returning to Category 1 homelessness or if they're receiving alternative services or self-resolving, but we don't consider them in that Category 1 area. So they're still part of the system, but they're not Category 1 homeless at that time.
So those individuals are tracked and followed differently.
Yes, they're receiving additional support during that time. So they are, most of them are going to be like in retention services and receiving the support to stabilize their situation, where those individuals on the point in time are identifying as currently Category 1 homeless.
Okay, thank you.
So the mayor referenced the point-in-time counts. Point-in-time is always a challenge because we recognize that homeless individuals are often in transition, and a lot of people don't appear in the shelters, but they may identify with a housing need. So this does not represent those individuals who are calling 211 or who are calling Salvation Army's Housing Assistance Program to be able to access those resources. What we want to do is look at more of those preventative and diversion type projects to be able to help people who are at risk of homelessness prior to getting into that position where they are literally homeless. So rather than saying that you have to be literally homeless when you receive a resource, we'd like to get to the point where there are more of those supports in place on the preventative side of things. And that way, those individuals who are making their calls to 211 and making their calls to Salvation Army are getting some of those resources on the front end rather than when they're actually being evicted or staying with friends or, sleeping in their car and things like that. We recognize that it's a challenge. It's very frustrating when people call coordinated entry and they don't have those resources available. But unfortunately, due to the limitations in our community, they have to prioritize based on that vulnerability of their categorization of homelessness. So those who are at risk of homelessness tend to receive fewer resources because there just aren't those resources available to folks. So we're hoping to be able to turn that tide and shift that, of course, with the collaboration of many of the initiatives that the city is involved in. Couple of things that we're working on right now. We have extended our current strategic plan. There were some areas that we had not been able to close the gap on achieving our goals. So we've extended that strategic plan for another year, which will bring us into 2019. That will give us an idea to kind of regroup and focus a bit more, but to also look at a broader community conversation around housing and what that looks like in terms of our next stage of strategic planning for the coalition. As I mentioned before, we have formed a youth action board and we've conducted the first Voices of Youth count. We will have a report out this week of a coordinated entry evaluation that was conducted in the spring. Many of those recommendations in that report address some of the issues that we've discussed already. How would you increase the resources that are available, but then how do you also clarify definitions around homelessness so that people have access to those resources? We're working in close collaboration with K-Connect. Many of you may be aware there was a community-wide call for a housing conversation earlier in the year, and we've been working very closely with them in helping to understand not only homelessness in the community, but also kind of the broader housing crisis and conversation that we're looking at from the affordability standpoint. So we're looking forward to participating actively in that conversation as it plays out over the next several months, and then using that as a springboard, like I said, for our strategic planning, for how we see the COC's role in ending homelessness and in affordable housing moving forward. And then finally, we have a financial modeling report and framework for analysis that came out early this year. One of the things that's interesting about this report, it does use a little bit older data, but it gives us an opportunity to look specifically at rapid rehousing projects and permanent supportive housing projects and explore how much investment it would take in those two types of projects to resolve the numbers when it comes to the point in time homeless and those who are currently in services. So we're looking to dig into that analysis a bit more and be able to then come back out to the community to say, if we were to invest dollars specifically in these areas, here's how we can reduce the instances of homelessness for the community. What questions can I answer for you?
All right, commissioners, questions? I know most of us are familiar with the work of the NTF. Wendy, I'm curious, I do feel like it's been a while since we've received an update, and I'm curious as you continue this work, particularly around strategic planning and data collection, and the recent point in time count for youth, what is a good report back to the commission, or is there a way for us to be updated more regularly, maybe not through a formal briefing, but even electronically? Is there a way that we can stay a little bit more abreast of what's happening with the NTF?
Absolutely. So a couple of ways that that I can speak to right now. I'm happy to provide more frequent updates electronically. I do provide updates on a monthly basis to my governance committee, but that gets into a lot of the weeds of what we're doing. So I'd be happy to do, a semi-annual progress report if that would be something the commission would be interested in. We can kind of look at what that would look like. I'm also happy to send reports as they come out from different subcommittee areas. So, for example, the coordinated entry evaluation report, if that's something that would be of interest, I'd be happy to forward those reports along. And finally, we have had a bit of a gap in staffing capacity for the last several months, but we're hoping to do some significant upgrades to our website and to the data and reporting that's available through our website. So we're looking to improve that quickly so that there's access at your fingertips to all the data that we've collected, all the reports that we're providing, but also kind of the progress on those initiatives that we're implementing. And then we do have a social media presence as well. So hopefully as we upgrade our website, we'll have that opportunity to have those links through social media.
Great, thank you. Commissioners, any other questions or comments?
No.
I would love to see the transit and every policy checklist once you get that finished.
Great, I'd be happy to send it over.
Yeah, you know, Wendy, I think if you just send us the reports, especially the ones that come out of the subcommittees, that would be, I think we would all appreciate that.
Sounds good.
So, great.
Thank you.
Thank you. Appreciate your work. All right, commissioners, my understanding, we have a lunch in 9:01. 2 of you will join me for Economic Development Project Team. The rest of you, I will see back here at 1:30. All right?